Hello everyone, today we'll be studying the topic Apexogenesis. So let's begin with the definition. It is defined as the treatment of a vital pulp by capping or pulpotomy in order to permit continued growth of the root and closure of the open apex. So apex refers to the root's apex, okay, and genesis means formation, okay. So simply it is telling that it permits the continued growth of the root and the closure of the root apex, okay. So what is the rationale? The rationale is maintenance of integrity of the radicular pulp tissue to allow for the continued root growth, okay. To maintain the integrity of the radicular pulp tissue to allow continued root growth, for the continued root growth. Now what are the indications? It is indicated for the traumatized or pulpily involved vital permanent tooth when the root apex is incompletely formed, okay. Traumatized or pulpily involved vital permanent tooth, okay, vital permanent tooth where the root apex is incompletely formed. In case no history of the spontaneous pain, no sensitivity on percussion, no hemorrhage, normal radiographic appearance, okay. Now the contraindication. Evidence that the radicular pulp has undergone degenerative changes, purulent discharge, history of prolonged pain, necrotic debris in the canal, and periapical radiolucency. So let's begin what is the procedure of the apexogenesis. First of all, the application of the rubber dam following the local anesthesia, then removal of all carious tooth structure and open up the pulp chamber. First of all, the rubber dam for the isolation, then anesthesia, then we'll remove all the carious tooth structure and open up the pulp chamber. Then remove the coronal pulp tissue with the excavator. Care is taken to prevent the damage of the radicular pulp. Then we remove the coronal pulp. Then rinse all the residual debris and control the hemorrhage by the placement of the moist cotton pellet over the amputated pulp. Then calcium hydroxide mixture is placed over the pulp stumps, followed by temporary restoration. Then there is followed up radiographs are taken periodically to check the root development. The subsequent goal is the root development, closure of the root apex, right? So we'll check by the radiographic examination if there is periodically they will check about the root development, and then once the root development is complete, conventional root canal treatment is done. Thank you. This is all about apexogenesis.